Alright, starting with our second, no, it's the third. It's a third neurodegenerative disorder, Huntington's chorea. So, in this, it's an autosomal dominant disease. What happens in it is that there is an Huntington gene uh, on chromosome number 4's short arm. So, what happens is there a trinucleotide repeat sequence defect. The CAG sequence has more than 40 repeats, thus leading to production of a defective protein which aggregates and causes neurodegeneration. Just repeating what I just said, in Huntington, now there is a defect in chromosome number 4's short arm where there is a trinucleotide repeat of CAG. More than 40 repeats of CAG shall be seen, leading to a defective protein production which aggregates and causes the neurodegeneration. The age of onset of Huntington's chorea is 25 to 50 years of age. Already I told you, it's autosomal dominant in inheritance. Two successive. Wait a second. Yeah, it's all right. Microphone is on. Yeah. So autosomal dominant inheritance. There are two successive generations. Whenever it affects, there are two successive generations that shall be affected. For example, if we see the pedigree chart here, the chance of its transmission to the next generation in an autosomal uh, in what do we call it, is, I believe it, if it was present not heterozygously, yeah, if it is present heterozygously in a person, the chance of its transmission to the person's offspring shall be 50%. As it is, as let's say a is present over here and small is present here, the chances of it transmitting shall be 50%. We have already done this in our high school or 12th class, whatever that was. All right. Both parents shall be affected. If both parents are affected, then there is a chance of 75% of transmission. Given that one of them is heterozygous and the other one can be, one of them has to be, both of them has to be heterozygous, by the way. All right. Only then can it be possible that one of their child is, if there are four children, one of their child has a possibility of being normal. So 3 is to 4 shall be the ratio here, and leading to a chance of 75%. Well, it's pure mathematics, it's pure genetics. We have already done these things. So let's revise what we have done on this page. So Huntington's chorea is caused by chromosome number 4 defect on the short arm. Trinucleotide repeat sequence of CAG. So CAG is repeated more than 40 number of times, leading to and defective, leading to an aggregation of defective protein, which causes neurodegeneration. All right. The age of onset is about 25 to 50 years, and we have already discussed that it is autosomal dominant in inheritance and the various patterns of its inheritance and the various pedigree charts that come from its pattern of inheritance. We've already studied them. Phenomenon of lengthening and anticipation. Lengthening means that the larger the defect, increase the severity, increase the severe the trouble, and earlier the onset of the disease. And anticipation means the anticipation is the outcome of lengthening. If disease is inherited from father, onset will be early in child. All right. The defect, say trouble, and earlier means if father had 400 repeat, there will be 40,000 repeats in child. Except this does not happen on mother's side. Mother had 400 repeat. There shall be 400 repeats in the child. All right. So there are concepts of lengthening and concepts of anticipation that work in Huntington's chorea. What lengthening means is that if there is a male who inherits this disease and he had about 400 repeats in his genes, in his DNA, then there shall be 4,000, 40,000 repeats in the child. This concept of increase in repetitions is known as uh, lingering. Right? These things don't occur on the mother side of the patient, these only occurs on the father side. Right? On the other hand, anticipation means is the outcome of lending. Disease is inherited from father. Onset will be early in child. Alright. So I think we have got what lending and anticipation means. Just to repeat what they are. And lending means that the larger the defect. If there are 40,000 repeats in the father, the his child shall have even greater number of repeats. Let's say 4 lakh repeats. Right. What anticipation means, anticipation says that if there are 4 lakh repeats, the onset of the disease shall be faster than a person who has 40,000 repeats. So this is what and lending and anticipation means. What are the clinical features of Huntington's chorea? There is autosomal dominant inheritance. Chorea and athetosis shall be seen, and dementia is seen. Autosomal dominant inheritance, we already know this. Dementia, this is something new I've got to know. Chorea and athetosis is present in its name, so it's nothing new for us. Chorea in these patients decrease with time slash chorea in these patients decrease with time slash severity. Right? Seizures are seen if inherited from father side. Personality changes may also be seen. Alright. Chorea over here is non-disabling. So let's again review what we have just read. Chorea in this patient decrease with time. Right? With time, the chorea of this patient shall decrease. And the chorea already is non-disabling in these patients. Seizure shall be seen. Now, if there are more repeats, the probability of facing a seizure by the patient, facing a seizure for increases. All right, for the patient. Personality changes may also be seen. So, what are the clinical features we have just read about? So, we formed a triad in which we said autosomal. It's an autosomal dominant disorder in one angle of the triangle, and on the other two there was something new that I just got to know today. There's presence of dementia and chorea. All the whole world knows the Huntington chorea shall have chorea in it. Anyways, chorea in these patients decreases with time and severity, and it's non-disabling. Seizure seen if there are inherited from the father side, meaning if there is lending and anticipation, it shall there are more chances of having seizures. Personality changes may also be seen. The pathogenesis of this happening is atrophy of the caudate nucleus. Alright, caudate nucleus is part of the basal ganglia. Alright, we knew that there is putamen here, there is globus pallidus here, and to attach to it there is caudate nucleus here, thalamus here, subthalamic nucleus here. So if there is atrophy of this nucleus, caudate nucleus, alright, atrophy of the caudate nucleus, increased dopamine, decreased acetylcholine, decreased GABA, intrastriatal decrease. Right, as you can see in these images, alright, just such as you can see there is a boxcar appearance that shall be seen on an MRI. So the pathogenesis is the atrophy of the caudate nucleus, in which there is increased dopamine, decreased acetylcholine, and decreased GABA. Right. So for treatment, we give dopamine antagonist like haloperidol or dopamine depleters like tetrabenzene. Alright, so it was about Huntington's chorea. Let's revise Huntington's chorea once again. In Huntington's chorea is a neurodegenerative disorder. That is something we know already. Huntington's chorea is a disease from the chromosome number 4, short arm. What happens is there is a CAG repeat, more than about 40 repeats shall be seen. Sorry. Trinucleotide CAG repeats more than 40 shall be seen, leading to a defective protein which shall aggregate to cause neurodegeneration. The age of onset is 25 to 40 years of age, and it is autosomal dominant inheritance. Alright, the sequence, now we can already make up more of these pedigree diagrams, pedigree charts, and I don't need to summarize them. Phenomenon of lending in anticipation is also present. Lending is a phenomena in which when the father inherits disease to his offsprings, the number of repeats shall increase. For example, if the father had 400 repeats, the offspring shall have 40,000 repeats. On the other hand, in the concept of anticipation, the concept of anticipation is just an outcome of the concept of lengthening. It says that as the number of repeats increase from the father to the child, obviously the onset of the disease shall come more earlier. So that was about anticipation. Also, these things don't occur when the disease is inherited from the mother side. Alright. The clinical features of this, we formed a triangle. Okay, inside the triangle we said that the first one of its angles says that it's autosomal dominant. On the other side it was dementia. Over here it was chorea. Alright, other things were that seizures frequency shall increase as the number of if it is inherited from the father side. Also, we said that there shall be personality changes, and also chorea is non-disabling and it shall decrease with time. Pathogenesis, caudate lobe is affected, dopamine shall increase, acetylcholine and GABA are decreased. On an MRI, we shall see boxcar appearance. Alright. For treatment, we give dopamine antagonists and dopamine depleters like haloperidol and tetrabenzene. The drug of choice is tetrabenzene. That's it for this.